Thanks very much, Chair, and thank you, Minister, and thanks for coming in, thanks for answering questions. I have to say I wasn't especially impressed with the submission, given that it did take quite a long time for us to get it. I understand there was an issue in the Department of Health yesterday, but just for, I suppose, for future reference, we would probably expect something a little bit more substantial, given that that there was a lot of delay. Minister, can I ask you in relation to the rollout of the flu vaccine for under 12s in particular? I understand that GPs were sent an announcement from the company Sinn Féin that there's been a delay in the procurement. So what impact is that going to have on the delivery and the rollout of that scheme? So we know there's going to be a delay because there's a delay in the vaccine getting here to be distributed. So what is that delay going to be in terms of weeks, please?
Thank you, Deputy. With regards to a detailed submission, I was asked to make a 5-minute opening statement. As you know, there was a very serious incident at the department yesterday, but any information, Chair, that the committee wants, obviously we will get it. But what I submitted was the opening statement, which is the normal protocol in this case. But Deputy O'Reilly,
just about the flu vaccine.
If there's any information you need, please let me know.
I will.
I will ask for a report specifically on how many weeks or how many days indeed any delay will be. However, I can give you a decent answer on the flu vaccine and what's coming if you like. We've got 1.3 million doses on order. It's sufficient for a 90% uptake amongst the at-risk groups and healthcare workers, all of which is going to be provided for free. To the specific version you referenced, Deputy, we've 600,000 doses of the live attenuated influenza vaccine, which, as you say, is being delivered via nasal drops rather than injection. That's going to cover 75% of 2 to 12-year-olds. We're targeting the groups, obviously, most likely to be hospitalised by the flu.
Okay, but you don't know as yet what impact this delay is going to have. And you said days, I'm saying weeks because the delay is weeks, so the impact is going to be weeks. So by my guess, you're not going to start the first series of these vaccines until, or the nasal delivery until October. Would that be about right, do you think?
That's certainly not the plan, Deputy, no. The plan is to administer this as quickly as possible. The original plan is September. I'll get a detailed note as to what delays may be occurring, but the plan, as I understand it, is September. Are you
aware of the delay from the company Sinn Féin?
No, I'm not aware of any delay.
Okay, so that was sent to every GP in the state, administered, and that is going to have an impact, and the impact, in my estimation, is going to be weeks. Anyway, but I will appreciate a detailed note on that. Can I ask with regard to contact tracing? So we were advised this morning that there are 100 people today. You said there's going to be 150 people working full-time on contact tracing by the end of the week. Where are these people coming from? Are they people who are being redeployed from other areas in the health service, or are they contracted just to do the work of contact tracing?
They're being redeployed from various parts of the public sector, Deputy, including departments, civil servants, the army and other places as well.
Okay, and are some of them redeployed healthcare workers?
To the best of my knowledge, no. None of them will be redeployed.
And none of the 50
workers
that are going to come in the next couple of days are going to be healthcare workers?
Sorry, say that again, Deputy.
There's 50 to be recruited or appointed or begin work in the next 2 days, according to yourself, because it's 100 today. You're saying it's 150 by Friday. So the 50 extra are not coming from the health service?
No, they're coming largely from the civil service. Okay,
that's excellent. So with regard to the numbers on trolleys today, so this is just a series of questions on capacity, if I could. So there's 130 people on trolleys. You know, I'm assuming that you will, as you did until very recently, accept the INMO figures on this, and we won't have the usual ding-dong about we count them this way, they count them that way. There's 130 people according to the INMO, and that's usually good enough for most people. Can I ask, with 40% reduced capacity due to COVID-19 measures, have there been any modular builds specifically to cope with COVID? And can you just say where they are and what the capacity that they will add will be. And I say specifically to do with COVID because obviously you and I would have taken issue with the previous minister re-announcing stuff constantly that had already been announced. So I'm aware of projects that were announced pre-COVID. You're aware of those as well. So are there any that are specifically related to COVID that will, in terms of modular capacity, and how many extra beds are they going to add into the system?
Thank you, Deputy. Yes, as with you, I am acutely aware of the number of people on the trolleys. As with you, I do accept the INMO figures. I appreciate that the HSE uses a different way, but you and I have used the INMO figures for a long time. With regard to the reduced capacity, can I say it's not 40%? So the reduced capacity, and Deputy Cullinan and I were having this conversation earlier on, the reduced capacity in terms of acute beds is reducing all the time. The figure we were given initially was 20%. That figure has now gone down quite a lot thanks to the work of the HSE, individual hospitals working with the HPSC on that. It is closer to 40%, as you say, for some issues like complex diagnostics and some more complex surgeries, but in most cases across the system we expect the reduced capacity to be significantly less than 40%, and some of the things we're doing to deal with that are extending the telemedicine for outpatient consultations and so forth. The specific numbers in terms of acute beds, additional acute beds, not pre-announced acute beds so far this year, is 400 acute hospital beds and 700 intermediate care beds. As you're aware, Deputy, they have been brought on board from a wide variety of places. Some of it is opening closed capacity within full-time settings. Other of it has been brought on board, for example, through the convention centre and other temporary places. The HSC is engaged very closely with the department right now.
Sorry, Minister.
I just finish this, Deputy, for you, if I can. In putting together a very detailed winter plan, it includes consideration of exactly the questions you've asked and how we turn the temporary additional beds into at least intermediate, medium-term and ideally long-term beds. Okay,
so the only modular capacity that you've referenced there is in the convention centre, so that's in UL, is that right?
I beg your pardon, Deputy, say that again.
The convention centre in University of Limerick.
I'm sorry, I can't
The convention centre.
What about the convention centre?
That you just mentioned.
Centre in the University of Limerick.
Yeah.
Oh, sorry.
That was UL that you were talking about there. That's why I wanted to stop you.
Yeah, look, yes, but there's...
Okay, so apart from that, sorry, just let me get my question. Apart from that, there's no additional modular buildings being added. So the capacity when it comes will come from closed beds already in the system. There's no new modular capacity going to be put into the system. Is that right?
There very well may be, Deputy, yes. So, for example, we have 29 additional community assessment hubs. They can be looked at. We have the 700 intermediate care beds, the 400 additional acute hospital beds. What I want to see is funding and resources to keep all of the beds that have been opened, to have them remain open. But obviously you'll understand some of the additional beds, like the intermediate care beds, have been opened in the community settings, which obviously are not long term. But part of the winter planning process is to look at exactly that question in terms of additional modular capacity that can be brought on very, very quickly.
Okay, so there's no modular capacity at the moment and you don't know where it's going to come, only that it might. Can I ask how many beds are currently closed because of staffing issues, because you can't staff them?
The hospitals are currently working at 96% capacity, so off a base of, I think, 11,000 beds, inpatient beds, we're at 96% capacity. There is no breakdown, Deputy, of exactly which beds are closed because of staff shortages, infection prevention and control measures. As I'm sure you'll appreciate, the hospitals are balancing an awful lot of different factors right now, including staffing, safe staffing, new protocols for staffing, infection prevention and control, but we're at 96% occupancy. The remaining 4% is for a variety of reasons. Okay, so with regard to the safe staffing model as agreed with the INMO, whereabouts is that at the moment? Is that in place? Is that in place everywhere? Is it in place in some places? Do you have a percentage figure for me? And we're running out of time here, if you could. The safe staffing levels that you and I both advocated very strongly for last year have not happened, unfortunately. What I found out was that whilst progress was being made, that progress was essentially stopped dead because of COVID. We are working with the INMO, and the INMO and I have met and discussed this. We continue to work it through with them to get to safe staffing for nurses and midwives around the country. It is a top priority for government.
And can you give a figure on how many consultants you expect to recruit before the end of the year?
I can tell you that there are 500 vacant consultant posts.
Vacancies, but how many are you expecting to fill?
I don't think anyone can answer that question right now. I'd like to fill all 500, and there are a variety of things that we're doing to that end. So we've agreed some of the C contracts. We're moving quickly on the new Sláinte Care contract, which essentially is like a contract, so we're looking to do that in the current Dáil term, and we will be looking at ways to address the new entrant pay inequality issues, which you and I have discussed many times before.
And just very briefly, well, I'll conclude on this. We know that about up to 600,000 people have deleted the app off of their phone. Minister, is there any confidence-building measures in play that's going to encourage people to download the app again? Because I'm sure you're concerned about that figure. I'd be very surprised if you weren't. It's in the paper today. Up to 600,000 people have deleted the app from their phone, so it's going backwards instead of forwards. So the figure of 1.7 million that I'd heard, obviously that's now not correct. Have you plans to put anything in place to ensure that people will have their confidence restored in the app, and that the uptake will start going in the right direction as opposed to backwards, which is where it's going now?
Thank you, Deputy. So currently we're at about a 35% penetration of the app. The international evidence suggests that we needed 25% for it to be effective. So we are well ahead of that, and I want to thank everybody for that. Could I just urge a word of caution, Deputy, when you state that people have lost confidence? Let's be very careful with what we're saying on this. This is a very, very important weapon in our arsenal against this awful virus. It is being used, it is being effective. I don't believe there has been a loss of confidence in the app whatsoever. It's working very well.
You have to have an alternative explanation for why people are deleting it off of their phones. I mean, a loss of confidence would be the obvious one to me. If there's another reason, you could share it. But I have the app on my phone. I have done as much as anyone to promote it. But if people are deleting it, they're not deleting it for any reason other than they've lost confidence in it, let's be honest.
Well, Deputy, I would just say neither you nor I know that. So given that we're the roles we're in, let's not just be jumping to those conclusions whatsoever. The app works. It was rolled out very, very successfully. It is providing valuable information to the contact tracers. It is saving lives. Everybody who has it on their phone is doing their part.
Thank you.